Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over effective wound management for diabetic wounds. But first, if you could hit that subscribe button, it would be greatly appreciated as it does help my channel reach more people. So let's get started. So why are diabetic patients prone to chronic wounds? So they're at an increased risk of chronic wounds due to multiple diabetic related complications that impair the normal wound healing process, okay? Low tissue perfusion. So this affects nutrient supply at the wound site. So the wound isn't getting the nutrients it needs to actually heal. So it's not an optimal healing environment. Neuropathic changes where they can't feel their feet properly. So trauma goes unnoticed in especially the feet and ankle region. Now, just to put it into perspective for you, 25% of all diabetic related hospitalizations are due to diabetic foot ulcers. Okay, 25%. That's a lot. The following risk factors have been identified for the development of ulcers in diabetic patients. So diabetic neuropathic changes, so where they don't have the sensation that they once did, okay? They can't feel the pain caused by a new pair of shoes, okay? If they've had previous ulcerations or amputations, trauma, foot deformity, infection, chronic ischemic changes, so their blood flow isn't bringing the nutrients that it needs to the lower extremities properly, okay? All putting the patient at risk for ulceration. So we'll look at the principles for diabetic wounds, okay? We want to make sure that their blood sugar is in control at all times, okay? So elevated blood sugar is associated with poor healing outcomes. So we should be keeping their A1C within optimal range, okay? Infection control. So they're in diabetic patients, they are compromised. So we need to make sure that we're taking care of any infection immediately. So really watching the nerves and stonies. If there's a high risk of infection, we want to be using our topicals, okay? We really have to, it's really a fine balance because we don't want to be using them too much, overusing them, but we also have to be very, very cautious because infections tend to go to the bone very, very quickly in diabetic patients, okay? Patient education. They should be educated on complications of diabetic foot ulcers, okay? They should be given advice regarding footwear and regular screening of their feet, okay? Foot care. So diabetic patients have a 34% chance of developing a diabetic foot ulcer at any point in their life, okay? So given the high risk status of these individuals, their feet should be inspected daily, okay? By them, they need to be looking at their feet before they put on their shoes, after they put on their shoes, when they go to take them off at the end of the day. Just education, super, super important. And they need to be looking in their shoes, feeling inside of their shoes. I had someone who had a tack in their shoe, had no idea, created a huge ulcer on their foot because it just sat and rubbed and ate away at their foot all day. But they couldn't feel it, right? So we got to be sticking our hand in our shoe to make sure that there's nothing in there, okay? Kids put toys in shoes. We got to make sure that nothing's in there, okay? Prevent trauma. Prevention is so much easier than trying to cure a foot ulcer, especially in a diabetic patient. Ivrin, seeing a foot care nurse to trim the nails, trim the calluses, it's super, super important because diabetic nails, they tend to get very, very thick and hard to cut. So you need to take proper care of the feet, and just educating patients to know this, super important. So local wound care solutions for diabetic patients. So first off, you want to follow whatever your facility's policy is. But these are just general guidelines. Debridement. So a lot of times diabetic wounds will get like a calloused outer edge. So the peri wound will become callous. There will be necrotic tissue. We need to make sure that we're debriding this area, removing this. It'll actually allow the wound to heal. Now we got to be very, very careful with debridement also. So it's a very conservative debridement when we're doing so, and it should only be done if you are trained to do this. Okay. Dressings, they need to be kept clean, dry, exudate free. Okay. The goal can be achieved with use of a variety types of dressings, hydrogels, hydrocolloids, alginates, foams, silver impregnated dressings. There's no good quality evidence available saying that one dressing type's better than the other. You have to use your clinical judgment, just in every other aspect of wound care. Clinical judgment is so important. Negative pressure wound therapy. This has been found to decrease hospital stays and complications associated with diabetic wounds. Faster healing time. It improves tissue perfusion, so it's bringing the nutrients that it needs, getting the blood to that area, reducing the edema, stimulating granulation tissue. So negative pressure wound therapy is a great choice. Once again, it can be hard with diabetic foot because it's on the foot, right? Offloading. Offloading is another great way. Total contact casting. Making sure that you have equal pressure over the whole foot and not just in one area. Okay. They'll also do offloading where, say, if it's on the front, they have actual shoes that the front is out of, and they're just walking on the back. So there's a lot of different offloading things that we can do. So we need to be utilizing these for diabetic patients. So preventing reoccurrence, and I want to say preventing to begin with should be like, we should be talking about this as soon as somebody has diabetes, where it just becomes an everyday thing. They're looking at their feet, they're taking care of their feet, because as time goes on, we want to make sure that they are set up to prevent ulcerations to begin with, because once we get one, we tend to get more. Okay, so unfortunately diabetic patients have a high rate of reoccurrence. So patients should be closely followed and monitored in the community. Patients should be told to regular visit either their foot care nurse, podiatrist, their doctor, to be looking at their feet, making sure calluses aren't building up too much. Because if we're getting strong calluses, that's how we get ulcers underneath them. Okay, they should be advised to avoid smoking, walking barefoot. They shouldn't be wearing uncomfortable shoes. Okay, as foot ulcers are caused, 70% of foot ulcers cause amputation. Okay, it's crazy. We have to be preventing. Okay, that's why I say right away we need to be talking to these patients and letting them know, like, this is something we need to prevent, because it does cause diabetic related amputations. Okay, 70% of them are caused by foot ulcers. Okay, that is why we need a surveillance system. We need to be always checking on our diabetic patients. We need to be looking at their feet. How many times have I know I've asked my patients before, does your doctor ever ask to look at your feet, have they ever talked to you about the importance of taking care of your feet? And a lot of them say no. So we need to, as nurses, be talking to our patients about prevention over cure. That's what I always say, prevention over cure, because to cure a diabetic foot ulcer, we have to go back to the preventative stages anyways. So we might as well just be doing prevention the whole time. So I hope you did get a lot of great information from this video, but that's all I have for this one, and I hope to catch you in my next video, guys. Bye for now.